Hi, everyone.
Hello.
Happy Tuesday. We hope everyone had an awesome Memorial Day weekend. It rained all weekend here in New Hampshire, but we have some nice sunshiny weather today. Annette and I had a few minutes in between clients today in the clinic. We thought we would jump in. We realized that we talk a lot about pelvic floor. Annette is a pelvic floor therapist. But we thought maybe it would just be helpful to explain what the pelvic floor is, what pelvic floor therapy does and how it helps, and just let Annette talk a little bit about this really specialized specialty that she has that can be difficult to find, and how it kind of really is a game changer for the kids that we work with in the clinic. Annette and I have talked all along about how, I could see these kids for nutrition and Annette could see these kids for pelvic floor therapy. Without the combination of the two, neither of us would be as successful as we are in helping these kids. So it's really almost like a magic partnership that we have to have both of these pieces. So Annette, before we even talk about like what the pelvic floor does and how it helps with pooping, how did you become a pelvic floor therapist? Like, what do you have to do? Can anyone become a pelvic floor therapist?
So that's a good question. So actually this May has been 20 years since I've been a PT. So that's pretty awesome. I've done most of my work with pediatrics. And so the pelvic floor, this wasn't really an option when I was in school. I was just telling Jess, I don't even think it was a subject when I was there, or like we didn't have clinicals in that area then. But anyways, for me, it was just having my own child have issues with constipation. So for that, I saw the different doctors. I checked out different ways to treat her. And here I was a PT myself thinking, why can't I help my own child? And that's what got me into the area of the pelvic floor. So I did have a mentor who I still have. I can still call today if I need help or have any questions. I've taken every course and still continue to take courses. Anything I can read, any information. There's a lot of different groups for the physical therapists with the pelvic floor. So I'm still learning as I go, but it's definitely been a fun road the past couple of years of doing it. So the pelvic floor, so that's how I got into it. But a lot of people don't even know. Here we are here. So this is the pelvic floor down here. It's literally a bowl of muscles. It's a shape of a bowl. And what it does is it supports your organs. So you have your bladder in here, your uterus for women, the intestines, and this is all supporting these organs here. So this helps hold that up. It also helps increase abdominal pressure. So for example, if you're like coughing or sneezing, or if you're jumping really hard, have you ever noticed that if you do that, you might have a little tinkle come out? Right, so your pelvic floor, these muscles down here will kind of tense to hold that and counteract that so we don't have leaking accidents. And then the main function that we all know is it helps control when we pee and poop. So normally during the day, these muscles down here are just kind of tense. Otherwise, we'd be having accidents all day long. So they kind of remain tense. And then when we have to go to the bathroom, what they do is they lengthen. So they go from like this, and then they lengthen and relax so that we can have a bowel movement or go to the bathroom, whatever we need to do. So that's pretty much that. Those are, the pelvic floor does a lot, but that's a few of the main functions.
I imagine if our pelvic floor isn't working properly, we are in big trouble, right? Like we would be having accidents a lot.
Right. Accidents. I mean, if it's not relaxing, then you're actually holding in. So you're withholding. That's when we get the withholders. They're holding in, then they're getting stomach pain because they're not going for every 3 or 4 days. And if it's not tensing and it's just loose and relaxing, then we're having accidents if we can't control that. So
and for the moms out there who might be joining in, I mean, this is the same thing we deal with after having a baby, right?
Yes.
And so just like, as a mom, when you have a baby, you might have challenges with your pelvic floor after having the baby, and you might be leaking. Kids can have problems with their pelvic floor where there's just some kind of dysfunction going on. Our friends over at Keystone Pediatrics say so much schooling happens after school. And that's absolutely true. To your point, Annette, finding out more about this after when you were in your profession.
Right. Actually,
So
I wish I would have known this earlier.
Yeah. So that's really helpful to know, like, what the pelvic floor does. So if our pelvic floor isn't working properly, we could be leaking stool.
Well, that, and with that not working, there's also the kiddos that are contracting and they think they're relaxing. So they're just doing it opposite of when they should. So a kid will come in and I'm saying, okay, let's tighten, and they're trying so hard and they're trying to do a bum or whatever, and where I want them to relax, they're actually tightening up down there, but they don't even realize that they're doing that. So that leads me into, what do I do in a typical evaluation or treatments? And I wrote a list because there's lots. So one of them is biofeedback. So you can actually use biofeedback, and we put little sensors on their bottom. Nothing is internal with kids. We do not do anything internal. You can't even tell you might feel the stickers. They're stickers. We put them on their bum. Anyways, you can tell if the child's contracting or relaxing those muscles, and then that way we can teach them, like, this is what you want to feel when you're having a bowel movement, or this is what you want to feel when you're tightening, so they can tell the difference between it. We do work on breathing. We do a lot of core activation, potty posture. How do you poop? Some kids don't even know how to poop, so we go over the technique of how you properly have a bowel movement. Pelvic floor relaxation and contracting, and then we do a lot of exercises. So there is a lot that we do, and depending on the child, how long it's been a problem, depends on how long their course of treatment usually is.
Great. And who should seek out a pediatric pelvic floor therapist? Like, what kinds of things might kids be dealing with that lead them to you?
So kids that are bedwetters after a certain age, kids that are having pee accidents during the day, withholders. I would say that's our biggest one that we see here. Definitely want to stop that as early as you can. Kids, painful bowel movements. Some kids say they can't feel the urge, or they don't know how to push. They said they feel it there, but they can't push. So pretty much any problem the kid is having down there, we can usually help.
Yeah. And kids that can't feel the urge at all, right? Like, that's a big one too.
Right.
Yeah. Good. Let's see, what else do I have? Oh, I think people hear the term pelvic floor therapy. They know that the pelvic floor sits inside our body. So I do think there's a lot of misconception about how invasive treatment for pelvic floor might be. And I know you mentioned that there's nothing invasive. I think and it's not even internal, but the closest thing that comes to it is when you place the leads
Electrodes.
for biofeedback. So can you repeat that, Annette? Like, where does that go on the child's body?
So they go in the muscle. So if this is their bottom, I may put one sticky here and one sticky down here, just like diagonal.
But that would be like outside. It wouldn't be like inside.
And a lot of times I'll even put the stickies on the model, and I'll have the parent do it themselves, because I know kids having a stranger look at them, so it's more comfortable for everyone, and the parents can do it. So it's
awesome. Good. And how long do kids usually work with you for?
That's a tricky. Usually I'll start seeing them weekly for maybe, I don't know, could be anywhere from 3 to 6 weeks maybe. And some of them I only see for maybe 2 or 3 weeks, and then I branch off to a monthly check-in. It really just depends on the child and how well they pick up what we're doing. And the benefit of us, though, is that if I do let them go for a month, I know they're seeing Jess at a different time in between there, so she touches base with me and to let me know what's going on if I need to step back in. So I think there's always one of us watching them, so whether one of us takes a longer break, we still have our eyes on them.
Yeah, and we've had a lot of kids that maybe I'm continuing to work with, and we kind of hit a plateau in progress, and I'll say, Annette, like, I need you to jump back in and see the child again. So that does work out really, really well. So, so good. So that's helpful to know all about the pelvic floor. If you are local to New Hampshire, you can come visit us at the Constipation Clinic at Therapy Square. We're located in Epping, New Hampshire. And remember, we have lots of different ways to help folks outside of New Hampshire virtually. We have virtual consults, we have our private Facebook group, and we have our upcoming poop boot camp that's starting in just a couple of weeks. So thank you, Annette, for sharing with us about the pelvic floor. If you have any questions at all about pelvic floor therapy, if you need help finding a good pelvic floor therapist in your area, Annette has a network of pelvic floor PTs around the country that she might be able to connect you with. But if you have questions about pelvic floor or need help with that, just let us know, drop it below, and we are happy to answer any questions you might have. All right, everyone, have a great afternoon. Thanks for watching. Bye-bye.